Goniometry of the knee. Normal measurement ranges from 0 to 135 degrees. The position of the client is prone, though this can also be performed in supine. Knees and hips extended and hip in 0-degree neutral rotation. The position of the goniometer. The axis is centered on the lateral aspect of the knee at the lateral epicondyle of the femur. The stationary bar is placed on the lateral aspect of the thigh, parallel to the longitudinal axis of the femur. The movable bar is parallel to the longitudinal axis of the fibula. It is aligned with the lateral malleolus on the lateral aspect of the leg.
Ankle goniometry, ankle dorsiflexion, 0 to 15 degrees. Position of the client, supine or seated with knee flexed at least 30 degrees, ankle at 90-degree neutral position, and foot in 0-degree inversion and eversion. Position of the goniometer, axis below the medial malleolus, stationary bar parallel to the longitudinal axis of the tibia, movable bar parallel to the first metatarsal. Client will dorsiflex the foot. Ankle goniometry, ankle plantar flexion, 0 to 50 degrees. Position of client, supine or seated with knee flexed at least 30 degrees, ankle at 90-degree neutral position, and foot in 0-degree inversion and eversion. Position of the goniometer, axis below the medial malleolus, stationary bar parallel to the longitudinal axis of the tibia, movable bar parallel to the first metatarsal. Client will plantar flex the foot. Ankle inversion, 0 to 35 degrees. Position of the client, seated, knee flexed to 90 degrees, leg over the edge of supporting surface, ankle in 90-degree neutral position. Position of the goniometer, axis, lateral border of the foot near the heel. Stationary bar parallel to the longitudinal axis of the fibula on the lateral aspect of the leg. Movable bar parallel to the plantar surface of the heel. Measurement begins at 90 degrees. Subtract from total. Ask client to invert the foot. Ankle goniometry, ankle eversion, 0 to 20 degrees. Position of client, seated, knee flexed to 90 degrees, leg over the edge of supporting surface, ankle in 90-degree neutral position. Position of goniometer, axis, medial border of the foot proximal to the MTP joint. Stationary bar parallel to the longitudinal axis of the fibula on the medial aspect of the leg. Movable bar parallel to the plantar surface of the heel. Measurement begins at 90 degrees, subtract from total. Ask client to evert the foot.
Hip flexion against gravity. Position. Client is seated with knees flexed over the edge of the table and feet above the floor. Observe. The client flexes the hip so the femur rises above the table's surface. Palpate the rectus femoris. Stabilize at the pelvis at the iliac crest on the side being tested. Resist proximal to the knee on the anterior surface of the thigh, downward toward the table into hip extension. Hip flexion, gravity eliminated. Position. Client is side-lying with the therapist supporting the upper leg in neutral rotation and slight abduction with the knee extended. Lower leg to be tested is extended at the hip and knee. Observe the client bring the lower leg toward the trunk, flexing the hip and the knee. Palpate the rectus femoris, and the weight of the trunk may provide adequate stabilization, or the therapist may stabilize the pelvis if needed.
Hip extension against gravity. The client is prone with hip at neutral and the knee flexed to 90 degrees. The therapist will stabilize over the iliac crest on the side to be tested. Palpate the gluteus maximus. Observe the client extending the hip while keeping the knee flexed to minimize action of the hamstring muscle on the hip joint. Provide resistance at the distal end of the posterior aspect of the thigh, downward and toward flexion.
Don't let me push down.
This is hip extension for the gravity eliminated position. The client is side lying. Therapist stands in front of the client, supporting the upper leg in extension and slight abduction. The lower leg is the one to be tested and is flexed at the hip and knee. You stabilize over the iliac crest. Palpate the gluteus maximus. Observe the client extending the hip, bringing the lower leg backward while maintaining flexion of the knee.
Come back up. Come back up.
Good.
Hip abduction against gravity. Position. Client is side lying with the upper leg to be tested with the knee extended and hip extended slightly beyond neutral and slightly forward rotation of the pelvis. Lower leg is flexed at the hip and knee to provide a wide base of support. Observe the client abducting the hip, lifting the leg upward. Palpate the gluteus medius. Stabilize over the iliac crest and provide resistance at the point just proximal to the knee in a downward direction toward adduction. Hip abduction for gravity eliminated position. Position. The client is supine. The therapist may use one hand to support at the ankle and slightly lift the test leg off the surface. Careful not to assist or resist the movement. Observe the client abducting the hip, moving the leg sideward while remaining in neutral rotation. In a clinical setting, the table will be wide enough for the client to go through the entire range of motion with the leg supported by the table. Palpate the gluteus medius on the lateral aspect of the ilium. Observe the greater trochanter of the femur. Stabilize over the iliac crest on the side to be tested. Hip adduction against gravity. Position. Client is side lying with the test limb lowermost. Therapist supports the uppermost limb in 25 degrees abduction. Observe the client adducting the hip by raising the lower leg from the table until it meets the upper leg. Observe that there is no rotation, flexion, or extension of the hip, nor pelvic tilting. Palpate the adductor magnus at the medial surface of the thigh and the adductor longus at the medial aspect of the groin. Stabilize by supporting the client's upper leg in partial abduction while the client grasps the supporting surface for stability. Resist over the medial aspect of the leg just proximal to the knee, downward toward abduction.
Okay, don't let me resist.
Hip adduction, gravity eliminated. Position. Client is supine. Limb to be tested is abducted 45 degrees. Observe the client adducting the hip towards midline. Palpate the adductor magnus at the medial surface of the thigh and the adductor longus at the medial aspect of the groin. Stabilize over the iliac crest on the side to be tested.
Hip internal rotation for against gravity. The client is seated on a table with the knees flexed over the edge of the table with a small pad placed under the knee if needed. Stabilize at the medial aspect of the knee. Client may grasp the edge of the table to stabilize the pelvis and trunk. Palpate the gluteus medius between the iliac crest and the greater trochanter. Observe the client internally rotating the thigh, moving the foot laterally. Therapist should observe that the client does not lift the pelvis on the side being tested. Resist at the lateral aspect of the lower leg, pushing the leg medially and therefore the thigh toward external rotation. Hip internal rotation for the gravity eliminated position. The client is supine with hips and knees extended. Hip to be tested is externally rotated. Stabilize over the iliac crest on the side to be tested. Palpate the gluteus medius between the iliac crest and the greater trochanter. Observe the client rotating the thigh inwardly and medially. This is hip external rotation against gravity. The client is seated, knee flexed over the edge of the table, and a small towel is placed under the knee for padding if needed. The therapist will stabilize at the lateral aspect of the knee. Client may grasp the edge of the table to stabilize the trunk and pelvis if needed. Palpating the muscles may be difficult. Observe the client rotating the thigh outwardly, moving the foot medially. Resist at the medial aspect of the lower leg proximal to the ankle in a lateral direction toward internal rotation. This is external rotation, gravity eliminated. Client is supine, hips and knees extended. The hip to be tested is internally rotated. The OT will stabilize at the pelvis on the side to be tested. Palpating these muscles may be difficult. The OT will observe the client externally rotating the thigh outwardly.